All right. We'll have a lot of surprises as we go through the next 3 days. It's my great pleasure to now frame the patient plenary panel. And we're very grateful to have among us a number of people who have benefited immensely from the work of the QIO program and from the ESRD networks. And we are going to hear from two of those individuals that have benefited immensely from the work of people in this room and hear their stories. And we'll also hear a third story of a gentleman who is a national quality improvement leader who really received exquisite care from the American healthcare system. And you'll learn from him how that happened and the significance of it in terms of its life-saving results for him. So that's what's going to be happening over the course of the next 50 minutes. If I could have the first slide of the framing presentation. This is kind of a way of looking at what we're seeking to do in this conference writ large. This is a simple continuum about innovation, nimbleness, and initiative. And it comes out of a book that many of you may have read by a gentleman named Stephen Covey. He wrote The 7 Habits of Highly Effective People. And in Principle-Centered Leadership, he talked about how it is in any relationship, in this case, the relationship of CMS to QIOs, the relationship of CMS to the ESRD networks, or even the relationship, say, that you have with your boss or with people who work for you, that there are different levels of initiative, different levels of innovation and nimbleness that you can have in that relationship. And what we aspire to is the highest levels. And what you see on this chart, the highest level would be check in and do it. Sort of at the lower end of the continuum, and there are lots of things on this continuum that aren't written on this slide, but at the lowest end would be wait to be told. And what we're seeking to do in this conference really is we're asking you to share with us your recommendations, your insights, your perspectives about what you can do to advance the ball aggressively and rapidly in the ways that Administrator Berwick, Barry Straub, Jean Mooney-Williams, and others have discussed with you. So that's why throughout the course of the next 3 days, we're going to keep coming back at you, and we're going to be asking you these questions. We're going to be listening carefully to your answers, and it's our intention to do everything we can at CMS to use the answers that you share with us. So that's just kind of a quick overall framing of why you're going to keep hearing these questions as we move forward. Now, in our patient plenary panel, which is where we're heading right now, we're going to profile the stories of 3 patients. Victoria Limon, and her story is going to be told by her daughter, Judy. We're going to hear from Andrew Williams directly from him and from his partner in ESRD network number 5. And we're going to hear from Dr. Frank Zampiello, a national quality improvement leader that had an amazing journey, a very serious medical event that occurred about 7 weeks ago with his liver transplant. And he's already back on the job here, sharing with you his perspectives as someone who has survived a very significant medical event. We will explore how involving patients in our work already has benefited and can further benefit the patients, QIOs, ESRD networks, and CMS. And as you listen to these 3 stories, these are the 3 questions I'd like you to be thinking about as you listen to them. And we're going to come back periodically during the course of this, and we're going to get some of your answers so that the whole community can benefit from your perspectives. What can we learn from the success stories of these 3 patients? And they are 3 success stories. Tomorrow, you're going to hear from Sue Sheridan. And when you hear from Sue, it's anything but a success story. So we're going to cover kind of both sides of this. We're going to cover sort of the great side this morning, but there's more that will happen tomorrow. What are the benefits of involving patients in our work, not just at the bedside, but here in our national transformation work that we're doing on the Affordable Care Act and on our work as the QIO program and the ESRD networks? And then specifically, what actions might you take as a result of hearing these stories? Those are the questions we'd like for you to be running on as you listen to these 3 stories. So I'd like to call up right now, if she would please join me on the stage, Judy Miller. Judy Miller is a quality improvement specialist. She's with Healthcare Quality Strategies, Inc., that is the QIO in the state of New Jersey. And she is going to share the story of her team. She's going to periodically call up a number of other members of her team over the course of the next 10 minutes or so as we hear this story unfold. Next, we'll hear after her from Renee Bovacalis of ESRD Network 5 and Andrew Williams, and then finally from Dr. Frank Zampiello. So with that quick background, I would like to invite everyone in this room to join with me in welcoming Judy Miller.
Thank you. Thank you. Thanks. Good morning. As part of the New Jersey Care Transitions Project, HQSI partnered with Compassionate Care Hospice, located, headquartered in West Hampton, New Jersey, who initiated Cardiac Connections, a program especially designed for patients diagnosed with end-stage heart failure. It was our pleasure to be able to collaborate with them. And now I would like for you to hear about Victoria Limon, who is one of the program participants, and her daughter Judy is with us today.
Hi everyone, I'm Judy Perino. I know it says Limon, but I was married 10 days ago. My husband John is in the audience. Thank you very much. Thank you. I'm here to introduce you to my mother, Vicki, and our family, and the impact that Compassionate Care Cardiac Hospice has had on us. My mother has suffered from heart disease for quite some time, and I have cared for her with the help of my family and friends for a long while. But I can tell you that it has become more and more difficult as her condition progressed. Sometimes overwhelming, even with the help of my family. Thank you. Fortunately, my mother has a wonderful cardiologist, Dr. Donald Haas. You're going to hear from him in a little while. And when he first started treating her, he told us about her disease, how it would progress, and the services that were available, specifically Compassionate Care Hospice. Now, I know that hospice can have a negative connotation for some, but I can tell you, for us, it has meant everything. Just unbelievable, the program. In the midst of this, I met John. I have never been married, 52 years old, never married. I just didn't think it was my time with caring for my mother. John had been a caregiver for his wife, his first wife. He's a widower. So he understood what it was like to be a caregiver, and that made a huge difference with our relationship and with my mother. When we met, I knew that we were going to spend our life together. I went home after our first date and said to my mother, I met the man I'm going to marry. Now, after 52 years, she was thrilled. Just thrilled that her baby, I'm an only child, was going to get married. Grandchildren were out, but, you know, we have a dog, Ginger. The most important thing for us was to get my mother to that wedding so that she could see me walk down the aisle and begin my life with John. And now, John and I met in January. With my mother's condition, we had originally thought we'd get married in May of 2011. And then we looked at each other and said, that just isn't going to work. So we were on the accelerated schedule. We met in January, we were engaged in March, I sold my house in May, we moved in with John, and in November we got married. My mother was very excited. During that time, my mother's condition really started to deteriorate, and she needed more and more care. She couldn't be left alone for long periods of time. It was becoming very difficult to manage my home, my job, give her the care that she needed, and plan a wedding. And we went back in to see Dr. Haas. We talked again about the program, and we knew the time was right for it. And it was no surprise because he had talked to us about this, you know, over the last couple of years. It was really wonderful. I have to tell you, the team that came in to care for my mother is nothing short of incredible. They are phenomenal people. She is Maggie, her aide, who comes in for a couple hours every day. She bathes her, she makes her bed, folds the wash. She just talks with her. And what that means for us is the time I spend with my mother is quality time. It's not chore related. It's not me always caring for her. We'll sit and have a cup of tea together. We'll go on the patio. It's wonderful to be able to do that instead of rushing to try to take care of all her needs and that being the only thing we could do. Then we have Erica, who's in the middle. Erica's her nurse. She comes twice a week. She checks on my mother. It gives her great peace of mind to know somebody's watching and taking care of her and following her. And many things we head off before they become issues. That's priceless for my mother. And then we have Lydia, who's not in the picture. She's my mother's social worker. She comes out regularly. She has spent many an hour talking to my mother about whatever is on my mother's mind. Now, my mother and I have very open dialogue. We talk about everything, including dying, everything. But, you know, she has somebody who, if there's just anything that she's a little uncomfortable about, she can speak to them. She's wonderful. And then we have Liz Lillo, who's our nurse practitioner. I have to tell you, Liz came out and signed us up for this program. We clicked immediately. I think the day she came out, I invited her to the wedding. Just wonderful. They are an extension of our family. We partner together and we take care of my mother. It's a wonderful, wonderful thing. And then we have Dr. Haas. We couldn't do this without him. My mother has great faith in him. He is a wonderful cardiologist, but he is one of the most kind, compassionate, and caring individuals I have ever met. In one of our early doctor visits with my mother, she had had a crisis. He said, you know, Judy, here's my cell phone number. You'll know when you need to use it. And, you know, that's the first time that's ever happened to me. Let me see. Oh, there we go. Look at this. Our goal was to get my mother to our wedding, and that was her goal. And we did that 10 days ago. She, not only the church, but she made the reception too. It was amazing. I think I might have gone one too many. There she is with Liz. We got to the church. My mother took over, or Liz took over for my mother. John and I didn't worry about a thing. She was well cared for. She stayed for most of the reception. She just blew us away. And this was a woman who said to me before, well, what am I allowed to do? Can I go everywhere? Can I do everything? I said, you can do, Mom, whatever you're up for. And John and I had already talked about it. We knew this was my mother's last hurrah. I said, you know what? If this kills her, I don't care. She can do whatever she wants. You know, we have always taken the approach where if she's having a good day, we do the fun stuff, manicures, pedicures. We don't go to the doctor. If we don't have to go, we don't go. One of the things that I have to thank Compassionate Care Cardiac Hospice for is we had a worry-free wedding and honeymoon. John and I thought we would only be able to go away for a couple of days, maybe to the Poconos. We actually spent a week in Disney while my mother vacationed at Hospice's Respite Care, Care One, right down the street from where we live. Beautiful place. When we got home from our honeymoon, I talked to her every day. She was fine there. Bingo, hair done, the whole works. She said, when I was on vacation, that's exactly how she looked at it. It was wonderful. We had a worry-free wedding and honeymoon. In the Northeast, one of our service providers, the gas and electric company's public service, they have a worry-free program for appliances. We have that for all of our appliances. Well, Compassionate Care Hospice gave us worry-free care for my mother. It was a wonderful thing. We all enjoyed it. Again, I said earlier, you know, hospice has a negative connotation for many people. For us, it has not been about dying. It has truly been about living. My mother is at home. She is surrounded by the people that she loves. She finds joy in every single day. And she's living a good life right to the end. And that's because of Compassionate Care Cardiac Hospice. And I am very grateful for that. Thank you very much.
You want to introduce Don?
Thank you. I would like to introduce to you Dr. Donald Haas. He's the medical director of heart failure and hypertension with Penn Cardiac Care at Mercer Bucks.
Thanks, Judy.
Thank you. You're welcome.
Thank you. I'm in private practice in central New Jersey, as you heard, and I am the director for Penn Cardiac Care, Mercer Bucks Heart Failure Hypertension Program. So I specialize in the treatment of patients with heart failure. There's been much progress in the treatment of heart failure patients over the past decade, but much of that progress has been surgical, primarily related to the implantation of mechanical devices. Unfortunately, there's not been a lot of progress in terms of improving the prognosis of heart failure patients with medications. And this is critically important because for many heart failure patients, all we can offer them is medical therapy. That's because frequently heart failure patients have significant comorbidities that preclude surgical treatments. Now, we know that for patients who have advanced heart failure, treatment with medications alone portends a terrible prognosis. In fact, it rivals that of pancreatic cancer or lung cancer. Now, in addition to that, the physicians who care for patients with heart failure frequently fail to recognize when those patients have slipped into the terminal stages of this disease. And it's not because they're uncaring. Patients who have heart failure frequently have the condition for many years. And as they slide into the end stages of the disease, it can be hard to recognize because it's very subtle. But what that leaves us with is a situation in which we've got patients who we can't cure, but are highly symptomatic. And unfortunately, very often, the only recourse they have to have their symptoms alleviated is to go to their local hospital, which is something that typically neither the patient nor the patient's family wants. So we believe that we can do better, and we can treat these patients better than care as usual. And so we created Cardiac Connections with Tony Bolden from Compassionate Care, Liz Lillo, nurse practitioner, and myself. And what we do in Cardiac Connections is educate the physicians and the providers in our community about identifying advanced heart failure. But more importantly, we recognize that, unfortunately, we cannot prolong the longevity of these patients through best medical therapy. But what we can do is improve the quality of their lives. And we do that by effectively treating their symptoms in their home. And in doing that, they're able to live their lives with dignity and on their own terms. And so I really second what Judy said, which is that hospice is really not about dying, but it's rather about living in a way that both patients and families can enjoy the time left that they have. Thank you.
No slide. And I'm going to just very quickly share with you, although the slide does not seem to be moving. As you would expect, we at HQSI are very impressed with the results of Compassionate Care Hospice Cardiac Connections program. They had increased heart failure enrollment, meaning people were able to receive services before the last minute, 0% unnecessary hospitalizations, 0% emergency department visits, increased hospice length of stay, and a high level of patient and family satisfaction. But of course, the best of the stories from Judy and her daughter, from Judy and her mom. Thank you very much.
Sorry about the slide. Yeah.
Okay.
Nice job. Very good. Good. If I could ask the AV gentleman to reverse and go back one slide, one behind this one, please. Nope, you're going forward the other direction, please. Back one more. Back one more. Oh, sorry, that's my fault. Go we need to go the other direction. I don't know if I should have jumped into this or not. There we go. Stop, stop, stop. Excellent. Thank you very much. This thing isn't actually connected to anything. We just push the button and hope it works. This is the summary of results that you just heard very quickly from Judy Miller, and I did want to call attention to these extraordinary results and to thank this team. You heard the story side of this, which I think is so important, but I think it's also important that you hear the data side of this story, and Judy covered this very well, but I wanted you to see this data because I think this embodies better patient care at reduced per capita cost. That's really what's happening here. This business of being readmitted over and over to the hospital has been stopped by the care that this woman has received that's less expensive, but it's a better quality of life. And I just really wanted to acknowledge what's going on here in terms of the three-part aim. With that, we're going to advance forward.